Everybody see it?
Yep, looks good.
Okay, thank you. Welcome everybody, and thank you so much. I'd like to once again thank Michael Sanson and his team for asking me to create these presentations. And I welcome you to part 2 of long-term care planning, what it is and why we need to prepare. You may recall my story with my father very briefly. He died in long-term care. He suffered from mixed dementia, which is Alzheimer's and vascular dementia and spinal arthritis. And he reached the age of 94 to teach me what it was like to age in Canada, which I have learned is not a pretty story. And so he is the reason that my life has taken the direction that it's taken. So here's our agenda for this evening. We're going to look at long-term care right now, what has gone wrong, specifically long-term care as it has been impacted by COVID-19. And as a result, there's been a tremendous interest in aging in place, which is what we will talk about. And we'll talk about the 8 steps to take to help ensure that one ages successfully in place. Then we'll turn over to the most popular questions that I get asked about long-term care planning. We'll answer the question why we should plan now. There'll be summary slides and resources as there were in the first session. So let's review very quickly what we talked about in session number 1. We looked at an overview of long-term care, including the main planning misconceptions, i.e., I'm too young to need long-term care, or I'll never need care. We reviewed the continuum, that is the path that one takes through the long-term care system from home and community care to end of life or palliative care, and the costs related to each of these stages. Once again, this evening we'll reinforce what governments do and do not subsidize for us, because it's so important that all of us understand this. And we will also look at funding options available to us that will make up for what governments do not do. For-profit versus not-for-profit care is a very hot potato now, especially because of COVID-19. We talked about the care conversation and why it's important to talk with our professionals and our family about what we want. And Michael and his team did send you out a PDF resource, the Care Planning Conversation, which if you did not receive, I know that he will send it out to you. And we did talk about Alzheimer's disease, which we will do again tonight because it is becoming such a very serious issue. We also reviewed some summaries and resources. So that was session number 1. Let's look, I'm sorry. That's right, okay, sorry. So let's look at long-term care. What has gone wrong? Why is long-term care critically ill? Well, what's gone wrong is that 4,000 have died in long-term care since April. More continue to die. Over 150,000 seniors and over 400,000 in Canada have unmet home care needs. In other words, the provinces are not able to supply the home care hours that seniors need to be able to remain in their own homes. In Ontario, 4,500 frail seniors are living in hospitals in what we call ALC, or alternate level of care situations. And this is happening across the country. In other words, seniors are in the hospital, staying there, not needing to be there, but remaining in a hospital bed because there is no place in a care home for them, or they cannot be cared for in their own homes. In Ontario, there are over 38,000 people on wait lists for beds. In Canada, this is well over 40,000 people. And shockingly enough, in Canada, 87% of what we spend on long-term care goes to warehousing older people in homes and a mere 13% is spent on home and community care, which means that $6 are spent on facility care versus $1 for home and community care, which is what we really all want. How did all this happen? Well, the fact is that long-term care has been ignored by Canadians and their governments for over 20 years. My dad died in long-term care 20 years ago. The care was not great then, and it has only become worse. There has been a complete lack of government oversight and accountability for what has been going on in long-term care. Across the country, older homes built in the 70s and 80s are crumbling, they're falling apart. No province has adequate or consistent funding for long-term care. There is an incredible shortage of staff. The staff are underpaid and mistreated across this country. No province had adequate personal protective equipment, infection training, or facility inspections of long-term care homes. Long-term care residents across Canada are vulnerable. They are voiceless. They are not heard by governments. And ageism has unfortunately reared its ugly head, and this is a prejudice or discrimination on the grounds of a person's age. Finally, Canadians want to age in place. And what I'd like to do is just to say to you that long-term care has really revealed how we treat seniors in this country. And I'd like to read for you a few words from an aging expert. And she wrote, "The problem is we don't value old age. COVID made ageism far worse as we saw people in nursing homes dying because their lives did not matter enough. Many people think that incompetence was the case, which is true, but ageism explains it better. We put loved ones in nursing homes, underfund them as a society, and hope that we ourselves will never need one." So those are pretty blistering words from an aging expert on the situation in Canada today. Now, COVID has made aging in place extremely interesting and important to Canadians. And we found this out very, very acutely through this survey that was done last July. And what this survey told us was that 85% of Canadians of all ages and the majority of Canadians over 65 report that they will do anything to avoid going into a care home. Excuse me, and that they are interested in doing whatever is necessary to remain active and healthy. However, they also admitted that they're not prepared should they be alone if there was a medical emergency in their own home. Excuse me. And the majority have not spoken to their healthcare providers about what to do if they were to fall. And this has really proven what I've thought over the last 20 years, that Canadians do want to age in place. They do want to have control over how they age, but they haven't done the work and they haven't done the research. So that's what we're going to talk about tonight, is successful aging in place. And here are the advantages. Right now, it's about the healthiest and safest environment in which to age. It's less expensive than a retirement home if you're healthy and don't need extra care. Living in your own home gives you independence. It gives you self-determination. It allows you to live in your neighborhood in a familiar environment with your friends and your neighbors. You can maintain your own lifestyle and habits. And hopefully you remain close to your family and to your community. However, aging in place doesn't always make sense for everybody. It doesn't make sense if you don't have enough family or friends for support, if the home requires extensive renovations to make it safe and or accessible, the home is not close to needed services, There's no place for an overnight caregiver or, for example, a hospital bed or other supplies that may be needed. And some seniors are simply not comfortable about having strangers or paid caregivers come into their own home. Some seniors are already feeling isolated and lonely. And if a senior cannot drive and has few alternate transportations, aging in place may not make tremendous sense. There are challenges of living alone, and many seniors do end up living alone. It results in loneliness and isolation, and it's really easy if a person is living on their own and they've got, let's say, hearing or sight problems, and they don't notice how their health is changing. Also, it can be challenging if you live on your own. You may be afraid of falling. You may have pain or memory problems, driving and transportation issues. But most importantly, there may be no one in the home in case there's an emergency. And this infographic really says it all. And let's see if I can bring up my little handy dandy pointer here. There we go. Right here, seniors who suffer from loneliness have a 64% higher risk of dementia. And interestingly enough, loneliness can be as dangerous as smoking 15 cigarettes a day. So that's why there is so much research being done on loneliness and isolation as we age. So what we are going to do, however, is concentrate on 8 steps to take for you to age in place successfully. And here they are. First, number 1, look after physical and mental health. 2, look at your home very carefully to assess it and modify it if necessary. Number 3, we're going to talk about falls. Number 4, being honest about driving. Number 5, we'll talk about the financial and legal work that one must do, how technology can help, and this is really interesting. Step number 7, social connections, and finally, the last and probably most important step about aging in place is talking to family. So let's look at each of these in a little bit more detail. Number 1, looking after physical health. Remain physically active. Walking is tremendous. It's free of charge, and it can be done anywhere at any time. Eat a well-balanced diet. Have regular physical checkups, and I mention eye and hearing because especially hearing problems are associated with an increased risk of dementia. Remain aware of your medical history and what you can do to either cope with the chronic conditions that you have or hopefully avoid them. Finally, make sure that you keep your brain active because what is good for your heart by remaining physical is good for your head. Also, step number 1, look after your mental health. Understand the signs and symptoms of depression and anxiety. And if you have memory concerns, see your physician promptly because there are things that can be done. And most importantly, stay in touch with somebody every day, friends, family, neighbors. Step number 2, let's look at assessing your home. Now, a home is familiar because we may have lived there for many, many years, and we may not see changes that should be done to keep the home safe and accessible. And there are 2 ways to modify life in your home. The first is through the use of what we call assistive or mobility devices. And the second way is through home modifications or physical renovations. So let's look first at assistive and mobility devices. And here are some examples of things that you can purchase to use to keep yourself safe and independent. In the bathroom, obviously grab bars A handheld shower head, a bath seat, and non-slip floor mat are extremely important and are a must-have. Help with dressing may be a long-handled shoehorn, Velcro fastening, or sock pullers. In the kitchen, there's lots of easy grip utensils, the ones with the fat handles. And many people have height adjustable cupboards and counters installed. With respect to moving and physical activities, canes, walkers, wheelchairs, using your phone, there's lots of things to make that easier. Loud ringing phones, flashing light ring indicators, large buttons, and of course, auto dialing. And enjoying your hobbies, there's playing card holders, special gardening tools, lots of devices for your television, your computer, and obviously there's audiobooks and large magnifying glasses that enable you to read the whole page of a newspaper, for example. Now, if we want to look at home modifications or renovations, the 6 most important things to consider are these. First of all, a walk-in shower without a lip or an edge on it so that one doesn't trip, or actually you can wheel a wheelchair into the shower. Number 2, grab bars in the bathroom, as I mentioned, by the front hall or front door is also a good idea. Number 3 is, if necessary, transfiguring or transforming the main floor so it can accommodate a bedroom and a bathroom to avoid stairs. Number 4 is replacing your knob door handles with door lever handles, which make things very, very easy if you suffer from arthritis, for example. Number 5, replacing slippery floors with carpeting. And number 6, don't use the stairs to go downstairs to do the laundry. Bring the laundry up to the main floor. Is this you in your home? Do you like scatter rugs? Do you wear knitted, loose-fitting slippers? How are your smoke detectors? How are your locks? Do you have, like my dad had, a low sofa or chair which is difficult to get in and out of? Do you have a lot of things around your home that may make you trip? And have you ever considered an escape route in case of fire? Many of these contribute to falls, which is step number 3, respecting the facts about falls. And whenever I talk about this, quite frankly, I shudder because my dad stood up, caught his heel on a scatter rug, which he would not let me move in front of his uncomfortable chair. He twisted, he broke his hip, and he went down. And quite frankly, that was the beginning of the end for my father. Falls are the leading causes of hospitalization for people, for seniors. 20 to 30% of seniors fall every year. And the very, very worrisome part is that only 1 in 3 tell anybody that they've fallen and actually seek help and support. And by the time you reach 90, the vast majority of people have had a fall. And incidentally, I will tell you that my 65-year-old cousin living in a condo came down the stairs this past Friday. She tripped on a brand new rug at the bottom of the stairs, and at 7:30 in the morning on Friday morning, ended up in Sunnybrook with a broken hip. They operated her on her Sunday morning at 2:30, and she's just been moved to rehab. So I cannot emphasize enough how dangerous falls are and how easy it is for them to happen. Oh, and this is what we call a stair lift or a stair glide. And if you are having problems in your home and you want to stay there, as you can see, these can go around corners on stairs as well as going straight up and down. And this is a really cool thing. It's called Stair Steady. It's available at Shoppers Drug Mart. and it folds down when it's not needed, but it's a tremendous support for going up and down stairs. And I have given you how to access this and more information in the resources at the end of the presentation. Something else that you might want to keep in mind if you're worried about falling, have fallen already, is that occupational therapists can be of tremendous help. They can help prevent disability and illness, and they can come into your home and they can assess your home and modify it to minimize the risk of injury. So they'll look at things like, of course, your stairs, your lighting, and your fall detection systems. They can give you simple solutions, and some of these are really interesting, like using sand on slippery surfaces, looking at your railings, and teaching you how to use a cane or other mobility device if you have one. And I have given you a resource on how to reach an occupational therapist if you want to do that yourself, or your family physician should certainly be able to direct you to an occupational therapist. Step number 4, driving. Once again, I refer to my dad. He drove, and one day he was driving to meet his friend Jim for coffee, and he hit a child. And to make a long story very short, the child was fine. I did consult a lawyer, and I took my father to our family doctor, who took away my dad's license, and my father never drove again. Driving can be very, very dangerous, and here are some of the reasons and the things to watch out for. When one stops at green lights or when there's no stop sign. When one gets confused by traffic signals. Stopping, running stop signs or red lights, what one calls a Hollywood stop. Having accidents or side swiping, and actually my dad did have a couple of these. I ignored them to my peril and to his peril. And finally, getting lost and having to call somebody for directions. There are options. You don't have to drive. You can depend on family or friends, public transport. Every province has provincial transportation systems. In Ontario, it's Wheel-Trans. Community agencies can provide drivers. Home care can provide. Obviously, there's options like Uber and Lyft. And you can open an account with a taxi company, which is what I did for my dad. All he had to do was give them a chit. He didn't need any money, and he could have a taxi to go wherever he wanted to go. Step number 5 in living well at home is doing the legal work, making sure that you have an updated will and you've given copies to those who need them, that you have powers of attorney for property and personal care, and that you have all of your information in one easily accessible place, your financial, your legal, your personal information. So it's not scattered in files all over the place, difficult to find. You may want to have a letter of direction regarding the distribution of personal property, and make sure that your end-of-life wishes are clear to your advisors, your healthcare team, and your family. You may want to have a separate advance directive, or you can include these wishes in your power of attorney for personal care or your mandate, depending on which province that you live in. And what about the financial work? We have to make sure that as we age in place, that we're living within our income, and that we have a set money aside for healthcare, repairs and maintenance of our home. And also, it's interesting that seniors more and more are looking at home share and home matching programs. And this is very, very interesting to explore, because there are thousands of older people in this country with large homes who have room for someone to move in and share. And this makes a lot of sense because that means that there's somebody there 24 hours a day. And these people can not only help with chores, but can be there in an emergency. And as a matter of fact, one of my neighbors, Lorraine, has had a U of T student living with her for about 5 years, and it's worked out wonderfully. Lorraine happens to have a dog, and the student will walk the dog on occasion to help Lorraine out. But she's also a wonderful person who provides company for Lorraine. So this is well worth researching home sharing and home matching programs. And once again, I want to emphasize what governments do and do not subsidize across this country. We know that they subsidize physician, hospital, and diagnostic care because these are a part of the Canada Health Act. They provide a limited number of home care hours on a daily basis, 2 if you're lucky. We know that provinces pay for the food and care in a care home, and residents pay for accommodation, which is generally called a co-payment. Provinces pay for assistive devices, for example, wheelchairs, and we'll talk a little bit more about this later on, and some senior services like PT or physiotherapy. Provinces do not cover retirement or assisted living facilities. Caregivers are not paid to stay at home to look after aging parents or spouses. There's a limited number of prescription drugs that are covered by provinces. Dentistry is not covered unless it's a hospital emergency, and very limited optometry is covered by the provinces. Step number 6, technology. How can it help? Well, this is very, very fascinating, I think. We all have heard about smart homes and how technology can, unlock and lock our doors, lower and raise our blinds, turn the lights on and off, turn our stoves off. Almost limitless what smart homes can do now. You all have heard about emergency response systems. You may remember the ads that featured a poor senior lying at the bottom of the stairs saying, "I've fallen, help me, I can't get up." So emergency response systems are tremendously important if you live on your own, and we've got some of those in the resource section for you. Virtual medicine has taken on new importance as a result of COVID, which means that we can now see a care professional from the comfort of our own homes. Smart gadgets are abounding. So they're smart pill boxes, smart monitoring, diabetic monitoring, smart blood pressure cuffs, and so on. Of course, there's apps for everything from entertainment to healthcare to reading to you name it, there's an app for it. And there are what we call voice assistants or smart speakers. And the leading one of these is Amazon Alexa, which you probably have heard of. And Alexa is a voice assistant who is there to answer your questions, to take your direction. And I recently actually purchased Alexa. She sits now in my bedroom on my bedside table. She is a clock, as well as a radio, as well as a voice assistant. So I can talk to her, I can tell her to set an alarm, which I'll tell you is a gift because you don't have to mess around with a clock anymore. She answers a question for me every day, and research has shown that these assistants actually help lonely seniors feel less isolated. And obviously, we all know about Zoom, FaceTime, and Skype. So technology is just a boon for being able to age in place. And last but not least are wearables. And I thought you would find this very interesting. These are all the things that are happening with wearables. If we start at the top, smart glasses can take videos, they can take pictures. Smart watches, I'm wearing a Fitbit right now, But the Apple iWatch is obviously the top level because it features an EKG and a fall detection system. Smart clothing, including shirts, have sensors built into them, which can send messages, healthcare messages, heart rate, blood pressure to your family physician. If we move down to smart shoes, these can tell a healthcare professional through an algorithm how you are walking, where the pressure is on your feet when you're walking, and how likely you may be able to fall. And if we move up to a smart finger, this is kind of interesting. You can see these two little devices. You put one on one finger and one on another finger, and you are able to tell the distance between the two fingers. Now, I'm not quite sure how that would help you unless you are doing some carpentry work, but nonetheless, you can see how wearables are really changing the way that we live, and there's changes every day in this technology. Step number 7 is reviewing and strengthening your social connections. And these are the things that you need to remember, that you have family and friends that you can rely on when you're living in your own home, that you have the ways of connecting that we have just talked about, that you know what your community can offer you, centers for recreation and socializing, and most importantly, that you always have somebody to talk to. And finally, and most importantly, step number 8, talking to your family and discussing, is it really realistic to remain in your own home until the end of life? Questions to ask: is your family ready and willing to help? Will you really talk to them while you are independent about the changes that may come up in your health or abilities? Will you be able to admit when and if you no longer can remain on your own? And do you have a contingency plan if this were the case? And why do these things not happen? It's mostly because changes that happen to us as we age are so gradual that we don't realize that things are changing and that we need to pay attention to them. So let's now move on to the most common long-term care planning questions that I get asked by people in webinars and by my clients. First of all, what are the risk factors that can predict the need for long-term care? Well, obviously the first is age. The older we are, the more likely we are to need care. Next is gender. Women do live longer than men, and they are at higher risk because we suffer more chronic illnesses than men do. If you have a disability, you are at higher risk. Single people obviously may need help from the system because they don't have family. But having said that, family is not always ready to step up to the plate. How is your lifestyle? Have you looked after your diet and your exercise? What is your present health? Having a chronic illness like diabetes or arthritis can be a factor for needing care, as well as the health history of family health history of something like Alzheimer's, cancer, or stroke. If one has mobility issues, that can increase the need for care, as can physical injuries such as a broken hip. And finally, obviously, living alone. Couples do tend to care for each other, but when one does pass away, the other is probably 100% going to be dependent on outside help. Next question: when should I start thinking about planning for long-term care? Well, obviously the best time to do it is before you need it. And when we're looking about planning for aging parents, remember the 40-70 rule that we talked about in the first session. When adult children are about 40 and parents about 70, it's time to start talking. And these conversations won't happen overnight. It'll take time to arrive at a plan. But when you start early enough, you've got the luxury of that time. And for adult children, for those of you who are looking at yourselves, the best time to start is in the mid-50s, particularly if you're interested in a living benefit such as long-term care insurance. Next, what do I need to know so that I can stay in my own home for as long as possible? Questions to ask yourself. Do I have family either in my home or nearby to help? Can my home be adapted? Is that possible? In some homes, it is not possible. They're either too old or they have been designed in such a way that the cost would be prohibitive. And in fact, I was working with a couple who were asking themselves this question about staying in their own home. And their home was problematic because the stairs down to the basement were so dangerous that I highly encouraged them not to remain in their own home. Is the home conveniently located for transportation? And are the services that I need near me? So can I easily walk to a grocery store, the post office, the subway, a pharmacy, or other services that I may need? And finally, if I remain in my own home, can I continue to interact with my community so I will not be socially isolated? And are care services available, things like Meals on Wheels and friendly visits? How can I be sure that I will make the right choices along the way as I age? Well, I have to tell you that you're doing it right now. Start researching care options before you need care. And there are what we call care management professionals available to hire who will help families make these kinds of decisions to help them make the right ones at the right time. And obviously, it's critical to ask, can I afford the kind of care that I want to have as I age? You may recall that moving to a retirement home could cost you $8,000 to $10,000 a month. So let's answer the question, why plan now? Why not wait? Firstly, Canada's aging population. We are going through a huge seismic shift in this country. By 2030, 1 in 4 of us, 25%, will be seniors. And once we arrive at 65, we'll have a 70% chance of needing some kind of care. Unfortunately, the problem not matching this is that federal health funding is not keeping up with an aging population's care needs. And to add to that is that the longer we live with chronic illnesses, which will need care and which will need money. Number 2, and I repeat this from our first session, the rising risk of Alzheimer's. It is becoming an epidemic. 500,000 Canadians have dementia right now, and 65% of those are women. One of the main reasons is, of course, is that the longer you live, which women do, the more likely you will have a chance of coming down with Alzheimer's. In fact, once you reach 85, you have a 1 in 3 chance of coming down with some form of dementia. One case of Alzheimer's is diagnosed every 9 minutes, and it's the most significant disability of those over the age of 65. There is no known cause or cure for Alzheimer's, although billions of dollars are being spent on it right now. And you may have heard of a new drug that has just been approved by the FDA in the United States. However, great controversy over this drug, which costs $55,000 a year and is not proven to be tremendously effective. The key here is reduction and prevention. And I will bring to your attention once again the 12 modifiable risk factors for dementia. Number 1 is getting as much education as possible. Number 2, watching your blood pressure, controlling it if necessary. Number 3, hearing, as we mentioned, make sure that you have your hearing checked. And if necessary, please wear a hearing aid. Number 4, if you smoke, stop. Number 5, look at your weight and try and control obesity. Number 6, watch out for depression and treat it if necessary. Number 7 is social isolation. We know that this is a risk factor for dementia. Number 8, inactivity is a huge risk factor. Number 9, diabetes. If you have it, control it. If you don't have it, please try and not get it. Number 10, drink responsibly. Number 11, watch out for head injuries. If you or your family, your grandkids, bike or ski, make sure that you wear helmets, because what they're seeing now in aging athletes is an incredible increase in dementia as a result of brain injury. And number 12, which is rather scary, is air pollution. Research is now showing that air pollution is a contributor to dementia, so that those who live near, for example, the 401 have a greater risk factor. And there's a wonderful series going on right now. It's called Alzheimer's, The Science of Prevention. It's a 12-part series which goes until August the 1st. I have been looking at it every day. It's been done by the best thinkers, doctors, and researchers in the United States about Alzheimer's. And you can catch sessions today until August the 1st. And there is also a way for you to purchase all of the sessions if you would like to do it. And I have provided the link for you to be able to catch a session today and until August the 1st. Alzheimer's, The Science of Prevention. Another reason to plan now, the unacceptable state of long-term care. What's going to happen? Can it be fixed? Will long-term care be integrated into the long-term care system? Long-term care is a poor cousin or orphan. It was not included as part of the Canada Health Act and therefore has been severely underfunded across this country. Are we going to have national standards in this country about regarding long-term care? We desperately need them. Are we going to get the new beds that we want? Are they going to continue to be beds that are built in large facilities? And are they going to be privately owned? Because in our first session, we did look at the problems with private ownership, which COVID clearly indicated. In the province of Ontario, they've said they're going to hire 27,000 more staff. I quite frankly cannot see how this is possible. Across this country, staff are leaving long-term care because they have been not properly paid or treated. Also in this country, will we reach the average of 4 hours a day of personal care, which is the international standard and which Canada falls very far short of? And what about funding for home care and community care, which is what we all want? Regulations on long-term care, will they be enforced? And finally, is there actually political will across this country to make long-term care a place where people want to end their lives? In my experience, there's been no political will. Another reason to plan now is COVID-19 and successive viruses. Canadians, quite frankly, have been stunned by the indiscriminate power of COVID-19. None of us ever think that we would go into a hospital and not come out. And nobody thinks that they would ever be put on a ventilator if we even know what it is. And I will tell you quite frankly that I have a very good friend who is a geriatrician. And as you may recall, geriatricians are those doctors who look after people over the age of 65. And she said to me quite honestly, Karen, if I got COVID and I ended up in the hospital and I faced going on a respirator, I would say no. So the time is now for advanced care planning, which I mentioned earlier, telling others what you want at the end of life, should you ever end up in the hospital in a COVID type situation. And for your information, we've suffered through 14 pandemics since 1918, and there is no doubt that there are more to come. And finally, another reason to plan is MAID, or medical assistance in dying. And I was asked by an attendee in the first session to talk about this, and I'm very glad to be able to do it now. So MAID was national legislation passed in 2016. And what it means is that it's a medical procedure involving the administration of drugs to end the life of somebody who meets the criteria and who has requested that their life be ended. Total MAID deaths through 2020 are 21,500. And to be eligible right now, you need to be over 18, be seriously ill, be suffering, have been given all the information that you need to make a responsible decision, and nobody has influenced you to ask for MAID. The average age is 73, which quite frankly I find young. The oldest person to have MAID is 104, and the main reasons for requesting MAID are cancer, neurological conditions like ALS, and cardiovascular disease. Now, an update on MAID is that in March of this year, Bill C7 was passed, and that bill has made accessing MAID somewhat easier in that it's changed the qualifications around having a reasonably foreseeable death. However, people cannot access MAID yet who are mentally ill, who are under the age of 18, or, and this is problematic for many people, who are worried that they will fall ill with Alzheimer's or some other form of dementia, and they want the ability to put in their documentation their wish to access MAID should they reach a certain point in the progress of Alzheimer's disease. For example, if I no longer can recognize my family, or if I no longer can get out of my bed, I want MAID. That at this present time is against the law, but there is great discussion going on about MAID across this country to open it up even further. There's great controversy. Many people do not believe in MAID. However, I think it's important that all Canadians understand what MAID is, and should they wish to know more, they can do their own research. A little bit more for you to remember this evening. This is very interesting. These are 3 questions that can predict your quality of life, courtesy of MIT's Age Lab. The first, who will change my light bulbs? What does that mean? Well, it means that when we live in our own homes, we need to have access to professionals who can help us do things like this. And an example is that couple that I mentioned earlier who were wondering whether they should leave their own home. They had a light above the stairs, and the husband could not access it and had to have his son come in to change the light bulb. Well, not everybody has a son or a daughter who are able to climb a ladder to do this. So we need to have people available to us to maintain our homes. Question number 2, how will I get an ice cream cone? This question refers to transportation. If you don't drive or can't drive, do you have transportation to get where you want to go and when you want to go there? And the final question, number 3, who will I have lunch with? Well, this is an indicator of your social network. People that you can be friends with, you can do things with, that you can depend on. And this question is critical for women, because so many of us end up living alone and are at risk of social isolation, and we know how dangerous that this can be. So here is your action plan as we reviewed in session number 1. Firstly, keep yourself healthy. Watch your diet, your exercise, stay out of the healthcare system. My cousin had her surgery at 2:30 in the morning and has had quite a few problems in the hospital. Try and not go there. Number 2, understand the diseases that you may face as a result of your family history, for example. Keep your home safe as you age. Have the care conversation that we talked about in the first session. Ensure you've done your legal work. Make sure that all your information is easily accessible in one place for people to be able to reach. Start planning how you will pay for your care, whether it's because you're going to stay in your own home, or you may want to move to a retirement home, or you may end up in a long-term care home. And finally, I can't emphasize this enough, keep moving. Stay active. One of the reasons that people end up in care is that they lose the strength in their legs, or they end up having a fall and breaking a hip or a shoulder or something else. And here are resources for this evening. The first is an article I wrote, Why Are Canadians So Upset About the Abuse, Neglect, and Death in Long-Term Care? I wrote this in April of 2020 because I simply I just couldn't grasp what was happening in long-term care because of what I knew had been going on for so long over the past 20 years. There is a checklist, thinking about your future, plan now to age in place. Just Google that checklist and it will come up for you. The Safe Living Guide, Google that, and it's put out by Health Canada. They used to have a booklet that you could order, but you can download this and it will walk you through every room in your house and tell you how to make it safe. There's a link for MAID, an interesting link, Living to 100. This is a Canadian site, and it's a series of questions that will, when you answer them, will give you a report and an age to which an algorithm says you're going to live. So if you're worried about outliving your money, go to livingto100.com. And here is the link to Alzheimer's, the Science of Prevention, the 12-part series that I mentioned earlier. Fall prevention. I guess you have figured how important I think fall prevention is. Stair Steady is that handle that we saw that is available at Shoppers Drug Mart. Philips Lifeline has been around for years. You've probably heard about them if you're interested in investigating a personal response system. The Mayo Clinic has a series of balance exercises that you can take a look at. Balance is critical for avoiding falls, and working on your balance is not difficult. It's not time consuming, but it is essential. And here's a link to the Canadian Association of Occupational Therapists for you to explore if you want to learn more about occupational therapy. And a tremendous book by George Locker, Falling is Not an Option, A Way to Lifelong Balance, which is available either online or in your library. I heartily recommend this book. Now, Michael, in his wisdom, asked me to talk to you about care subsidies and tax credits. And unfortunately, I can't go through every province because we simply don't have the time. But many provinces have, the first thing we'll talk about is an Assistive Devices program, an ADP program. And these are programs that subsidize what it says, assistive devices. So you have to be a resident of a province, have a health card, and have a disability requiring the equipment or supplies. And ADP programs cover wheelchairs, mobility issues, hearing aids, communication tools, and visual aids, diabetic equipment, and many, many other things which I can't list here. But Google Assistive Devices program in your province and you will come up with the program which you can research. And the other thing is, happened in Ontario very recently, the Seniors Home Safety Tax Credit. This is a refundable personal income tax credit that helps keep you safe in your own home. It's worth 25% of up to $10,000 in eligible expenses. In other words, $2,500 can be a credit. Who qualifies? If you're 65 by the end of 2021, or people who live with senior residents can apply for this tax credit. And what you can purchase are grab bars and other reinforcements for the bathroom, which we've talked about earlier, wheelchair ramps, stair lifts, which we've talked about, elevators, and renovations to permit a first floor occupancy or suite for a senior. In other words, a bedroom and a bathroom. So I'm sure that every province has a relevant home safety tax credit, so just Google that in your province. Here are my personal resources for you, my website, which has lots of information and articles. It's never too early to start the care conversation, which was the PDF that Michael and his team sent out after the first presentation. I have a practical planning guide. The Critical Illness and Long-Term Care Planner is a place to record everything about a person needing care, from their nickname to their end-of-life wishes. And finally, the 10-Step Long-Term Care Planner, which asks you 10 questions, and by the time you do your research and answer the questions, you essentially have created yourself a blueprint for your long-term care plan. And these are available on my website. And a handout for you today, thanking you for attending today's session, is my long-term care planning assessment guide, questions to help you plan for your aging and long-term care. I hope that when you receive this, that you will review it and answer the questions to help you in your long-term care planning. Here is my contact information. And finally, I'd like to end with something very interesting. I hope you find it's interesting. Sherwin Newland died in 2014. He was a brilliant surgeon, bioethicist, speaker, and award-winning author of many books, including How We Die. And here are a few of his words on aging and how it catches us up by surprise. And I'm quoting Dr. Newland. So gradually a progression is the onset of our aging, that we one day find it to be fully upon us. In its own unhurried way, age soundlessly and with persistence treads ever closer behind us on slippered feet, catches up, and finally blends itself into us, all while we are still denying its nearness. Let's not let aging catch us by surprise. Take the time to research and plan for how you want to age so that you can end your life and your years with independence, dignity, and control. Thank you very much for your attention.
Thank you, Karen. That was fantastic. Now, what you want to turn the share screen off?
Yep, absolutely.
So, obviously my premise is always going to be around the planning aspect of things. And when Karen was talking about the Ontario Safety Tax Credit, this is a credit system that changes every few years. So if you remember 6 years ago, you would get tax credits if you energy efficientized your house, putting in insulation, redoing your furnace. And these items are documented. So you get to know exactly what they cover and what the refunds are. Typically, when you're having renovations done in your home, it's more than one room. So making your contractors aware of how to invoice and how to itemize the actual concepts of what you're doing in your home makes that credit much easier to achieve. And we'll talk about that in more detail. I'll start off the questions, and then I'll pass over. I see some from Majid, and a couple of other questions have come up. My mom is a little over 70, and when we've started this conversation, one of the hardest things, or one of the very first steps, was me getting her a cell phone. Now, getting my mom a cell phone on its own was not nearly enough. She would not carry it with her. She never answered it because I would keep calling her on the house phone. So in order to change her actions, I had to change my actions, and all I would ever do is call her on her cell phone now. That got her enticed to using it. It was a challenge. My wife's mother didn't have email, wouldn't go on the internet. We tried any number of things. What did it was Facebook. She fell in love with Facebook. Before you knew it, she was posting online, checking her emails, and having parents that are internet aware is extremely important, because otherwise they don't have that ability to get the information for themselves. Majid had a question. It's, how does MAID affect the insurance death benefit claims?
Well, that is a very good question, and quite frankly, I don't know the answer. I don't know if insurance companies have grappled with this issue or how they have. I'm sure that they are, but I would suggest that you talk to your insurance company about this and see if they have arrived at any conclusions. But quite honestly, I don't know if there's been any legislation around this or not.
Right now, with Manulife, it's nothing definitive on the long term. What they have come out and said is it's very, every insurance policy is voided within 2 years if there's an act of suicide in the first 2 years of buying an insurance policy. And right now they are finding that that's the route that they're taking.
Okay. Thank you, Michael. And I will actually, it's a very good question, and it's going to push me to do more research on this, because it's definitely going to be an issue that insurance companies and Canadians will face.
So here's another one. Before you call an occupational therapist to get these ideas of what to do around your home to make it more easily accessible, easy to live in, is there any passive research you can do? When my mom was renovating her house, she lowered all the countertops in case for a wheelchair. She did the no step into the shower, but she did all of this because her mom struggled with all of these things. So before you go out and hire somebody to, is there I guess the best idea, is there a YouTube or a Netflix series like Flip This House or Safe Device My House?
You know what? I don't know if there's a YouTube series. It would be fabulous if there were. But what I did is in the resources. Remember, I gave you the Health Canada resource, the Safe Living Guide. Download that, and it will take you through your home, room by room. And the other thing that I gave you was the checklist. So just Google that title that I gave you for the checklist, and that will also tell you what you should be doing that you can do yourself before you think you need to call in an occupational therapist. So there's a lot of tools right at your fingertips.
And guys, if you want to ask Karen a question yourself, just put your hand up and I'll take you off mute. But another question we have here for you, Karen, is why haven't Canadians and or seniors lobby groups been successful in getting the government to increase funding? Why are we falling so short compared to other places around the world?
That's the question of the hour. Canada is, wow, we are very far behind many countries in the world, namely European countries, Denmark, Sweden, Japan. For some reason, when we developed the Canada Health Act, when it was developed in the 60s and 70s and finally passed in the 80s, we, in our wisdom, did not include long-term care in the Canada Health Act, which would have guaranteed funding for long-term care. And because in this country, we've got essentially 13 different healthcare systems, every province takes the money that Ottawa sends them, we call the transfers, and the provinces are free to spend that money however they want. And one of the problems that COVID pointed out to us very clearly was because we've got 13 systems, we have no national standards, we have no national accountability. And way back in April, when all of this started, Trudeau was asked about getting involved with the provinces and mandating national standards and accountability for the money that Ottawa transferred, and he refuses to get involved. It's just a nightmare, the power, and now this is my opinion, the power that provinces have and will not give up when it comes to healthcare. So we need to look not only at the federal government, but also at our own provincial governments who decide how they're going to spend the money and where they're going to spend it. And quite frankly, provinces have not been listening to seniors because seniors keep telling provinces, I want the money spent in my community so that I can stay in my own home. So what we need to do as seniors is band together and keep lobbying our provincial governments and the federal government to tell them exactly what we want as we age. Things will change as a result of COVID. The pressure is on. But what we need to do is not let that pressure off. Because as I wrote in that article that is in the list last April, if change does not occur as a result of COVID in long-term care, it never will.
We have another question here from Leslie. Second question. We have been thinking about moving out of the city to a more rural location up north. Are there any disadvantages in terms of access to service that might make this move risky?
In a word, yes. The resources in this country are centered in urban areas, in the large cities. And we don't even have adequate internet access around this country. So we certainly don't have adequate healthcare access either. So if you are considering a move into the country, what I would highly advise you to do is research where the hospitals are, where the care homes are, where the seniors community centers are, how the transportation is. All these things that are going to influence how you age. Because quite frankly, if I were a senior, I would not move to an area where these things were not accessible.
Yeah, I guess it's about proximity to family and services is going to be the number one driver on that. We actually sat down with a realtor. His name is Blake Schaefer. His premise is all about smart sizing your home. So he's a home consultant, and he actually knows the entire retirement communities, long-term care communities, and it's a downsizing expert. What he brought to my attention, and this was just 2 days ago, is that Mississauga has the most retirement homes, not long-term care facilities, but retirement homes per capita in Canada. Mm. Burlington has one of the lowest. So it's 25 minutes apart, but it does show you just how much variety there is depending on where you are. If the supply is there, you can get it. If it's not there, to lunch. So one last thing before I let everybody go, before we call it, I just want to show you this very quickly. So this is the package you're going to be receiving in the next with the slides and the recording. This is an assessment guide. Now, I know most of you. You want to click a yes or a no and get an answer of what you should do next. That is not what this is. This is, again, building your experience, building your knowledge base. What we'll do is we'll look through this, be as honest as you can, but don't expect you click a yes or a no and it's going to tell you what to do next. We'll go through that throughout our next sessions. And it's really to get those juices flowing inside of your brain. Some of you are on here for yourself. Some of you are on here for your parents. So we've all got different objectives from this two-part series, and I'm looking forward to seeing what comes from it. So that's it. I'm sure there's going to be a lot of follow-up. I'll have the recording, the slides, the resources out to you by Monday, and maybe Tuesday. Monday's a holiday. And thank you all very much for attending. Stay safe, stay healthy, and God bless.
Thanks very much, everybody. Thank you, Michael.
Thanks.